Yes, my name is Enrique Soto. I'm a medical oncologist working at the University of Colorado Anschutz Medical Campus in Denver. And I am a member of the board of directors, and I'm also the chair of the Science and Education Committee for SIOG. Well, the mission of the Science and Education Committee is, one, to endorse educational programs for geriatric oncology worldwide. Another thing that we do is we review and approve SIOG guidelines and other consensus statements that are made. And in general, we supervise that the content that comes from SIOG has a high quality of evidence and actually leads to improvements in the way we treat older people with cancer. Well, this year, we're actually trying to look at ways in which to improve the way in which we do clinical guidelines. We are trying to create a new policy for improving how guidelines are made within SIOG and trying to figure out which of the aspects of geriatric oncology need new guidelines and which guidelines need updating. Well, mainly what we're doing is supporting people worldwide who are developing new educational activities in geriatric oncology. So, for example, this year we endorsed an educational geriatric oncology course in Morocco, which is very important because we want to extend to new areas of the world. And we are also endorsing a new master's program in geriatric oncology in Madrid. So these types of programs and also specific meetings are what we endorse. We review the programs and make sure that they represent the spirit of SIOG and that they actually advance the science of geriatric oncology. Well, SIOG has a lot of guidelines that people can use in their everyday clinical practice. They're all accessible in our website. So I encourage everybody looking at this video to go to the SIOG website, take a look at the guidelines and use them in their everyday practice. And also to look at the various educational programs that we endorse worldwide. Find there may be some programs close to your home that you can attend to. Well, there are a lot of ways in which this can improve the way in which we treat older people with cancer. We collaborate with other committees in order to create guidelines and educational programs that represent everybody within the society and that provide clinicians and researchers with the tool to treat patients with cancer better. Well, I think that investing in science and education is essential for any area of science and of medicine in particular, right? And that the work that we do in the committee and the work SIOG does as a whole is everybody is committed to advancing science and education, right? We are just the tip of the iceberg in making sure that the guidelines are well done and that everything is vetted by SIOG.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.